What's going on, guys? Tony here. So in this video, I'm going to do a little keyword research for our good friend Janet D, the PT, and I'm just going to kind of take you through the process. So I've got an incognito browser right here behind me so that none of my search history will show up. One of the topics that Janet and I were talking about was becoming undiabetic. That is a term that she is using to kind of work on a series that she wants to get out there. And I think it's a great series. It's a great niche. It's exactly the kind of stuff that we need to be talking about. And I tend to, full disclosure, my bias is, I don't view type 2 diabetes as a disease. I view it as a symptom. It's a signal of other stuff going on in the body. And so, yeah, like there is absolutely great information out there regarding reversing it. So let's see if we can put our minds together on this and see what people are searching to help Janet bring the content to the people that are looking for it. So let's just start with, I'm going to go straight to YouTube, and I'm going to see what YouTube gives me in the autocomplete. So let's go with type 2 diabetes. And so, of course, we have diet, symptoms, day in the life, treatment explained, recipes. How about reversing? Reversing type 2. So, starts with ignoring the guidelines. Now, this was a TED Talk that I thought was great. Watched it multiple times. I don't know, Luke, what that's about. I'm just going to go with the main topic here. How to reverse type 2 diabetes, how to reverse it. So, we've got 6.5 million views, 33,000 views, 28,000 views. Obviously, there's plenty of support for a topic like this. What about something like type 2 diabetes and shoulder pain? Frozen shoulder, how to prevent frozen shoulder in sugar patients. Interesting. Obviously, shoulder comes into play when we're talking about physical therapy. We're talking about diabetics, stress, higher blood sugar, and shoulder pain. Now, this one only has 1,000 views and it's 5 years old. Let's try pregnancy, keto diet, COVID. So Janet had done a COVID recovery video, and she's been doing stuff about type 2 diabetes. So these might be some interesting kind of keywords. Why COVID is dangerous for diabetics. These would be some great topics for her to consider. Now let's take this kind of another direction. Let me give me just a sec. I'm gonna grab, okay, switch screens with you guys here if I can find it. Hang on. Nope. Still nope. Sorry, guys. I'm not editing this, so forgive me. Here we go. That's what I want. All right. So let's go into Google Keyword Planner. And let's see if we can find some ideas through here. So I definitely think we've got type 2 diabetes and COVID recovery. We've got type 2 diabetes and shoulder pain, frozen shoulder. I wonder, okay, so we've got plenty of search volume, but these are going to be super competitive. When you see a competition low type 2 diabetes, that's referring to paid ads. We're not doing paid ads for this. I wonder, reversing type 2 diabetes with exercise. Can exercise cure type 2 diabetes? Low competition, low average search volume. But this would be a great potential video to look at. So let me highlight that. I'm going to go in. I was watching our good buddy Chad. Can exercise cure diabetes? Is diet and exercise effective? Type 2 diabetes reversible? You know, I mean, 88,000 on that one, 58,000 on this one. They're pretty old videos, which gives them time. But exercise program here, 7,000. #1 exercise program at home for type 2 diabetes. So I think the greatest challenge is we know in our head. Now let's just take a look for organic search. We know in our head what we believe people want to know, but that's not what they're searching for. What's the best exercise for type 2 diabetes? How does exercise help? Can diabetes be cured? So let me copy that and let's drop that back in here. Total body exercise for type 2 diabetes, 910,000 views. Now glucagon, I'm guessing it's a like diabetic specific page. And then we've got Bob and Brad, another 491,000. And I've seen this guy, Yuri. You know, a great one to discuss. Let me go back here. Can diabetes be cured with exercise? What is the best diabetes? Sleep and type 2 diabetes. Let's see if we get anything. This will be the last thing we look at here, guys. But I want you to see, you know, so this would be something I would copy that list. How does type 2 diabetes affect sleep? How should I sleep? Does sleep affect blood sugar? How many hours of sleep? Sleep apnea and type 2 diabetes. Is there a connection? You know, these are great topics, right? Can Cpap help diabetes? Treating your sleep apnea can also help control blood sugars. Those connections are really well established. There's proof that people are searching for this. Let's take a look at this. And where I would go with this then is I would say, okay, we can talk about sleep apnea, but we can also talk about the benefits of exercise related to sleep. If we sleep better because we exercise, we can potentially reduce the impact of diabetes. If we can't assume comfortable sleep postures because of, you know, orthopedic issues, we do exercises specific to low back pain, sleep better, improve our blood sugar management. These are the directions that I would think a PT would want to take, but it's still broad enough, wide enough that you're not necessarily giving specific recommendations and you're still in kind of that wellness world. So, all right, guys, I'm going to wrap up, but I want you to see. So what did I do? I used incognito browser. I just started searching ideas, incognito on YouTube. I looked at Google Keyword Planner. Certainly you can use Uber Suggest. You can look at other, you know, if you want to get into paid keyword tools. And then I just started kind of experimenting. And I looked at people also ask suggestions. I looked at autocomplete suggestions. And there are more ideas than you can ever get through in a reasonable amount of time. So it's not that I want to stifle your creativity, okay? But there's a huge difference with you being creative once you have an audience versus you trying to attract an audience. Janet is still in the audience consolidation development phase. She wants to attract an audience, build rapport, build trust. Let's save the more creative ideas for kind of 5% of the content. Let's take 95% of the content and focus on what people are actually searching. Guys, I hope this was helpful. If it was, like the video, subscribe to the channel, and I'll catch you the next time I do some more market research on a health related topic.